Hello everyone. Today in the series of Docplexus KOL interviews, we have with us Dr. Nick Morrison. We are really obliged to have you here, Dr. Morrison. He's the president of the International Union of Phlebology. Practicing since 1996, he has dedicated his work towards the care and treatment of venous and lymphatic disorders. He's a leader in phlebology research. Thank you, doctor, for your valuable time.
You're welcome.
Shall we start with the interview?
Yes.
So, Dr. Morrison, which of the latest techniques for the superficial venous treatment is the best in your opinion?
Some things that have developed over the last few years don't require the use of tumescent anesthesia, and that makes it much more comfortable for the patient. So I prefer those what they're called non-thermal, non-adhesive technique. I'm sorry, non-thermal, non-tumescent technique. And that's a nice technique for patients because it's easier to go through. So there are a number of those. The ones that we studied most involve an adhesive, and that's the one we use quite a bit of. But we use all manner of ablation methods, just starting to prefer the non-thermal, non-tumescent techniques.
Can you elaborate a little about this technique so that our community can get to know about it?
Sure. The non-thermal, non-tumescence requires the patient in a simple office room. It doesn't require anesthesia, it doesn't require an operating room.
Okay.
And they come in under local anesthesia. We put a small catheter into the vein and treat the vein as we pull the catheter back out. So they come in, they have a procedure. It may take half an hour, and they leave. They're right back to their full activity immediately.
That's very interesting, Dr. Morrison.
Well,
very interesting.
And it's especially interesting considering what we used to have to do.
Exactly.
Stripping. It was a difficult procedure for patients to go through.
True. I totally agree. So moving forward, would you like to comment on the current practice guidelines for superficial vein treatment?
There are a number of guidelines that are very fluid. Because the technology and the methods of treatment are changing all the time. The guidelines change as well. So currently, all of the non-thermal, non-tumescent, and the traditional thermal ablation techniques are all still used. As the technology changes, those guidelines will have to be updated.
Yes, true. So any guidelines particularly that is right now going on which should be followed?
Generally speaking, yes, I would say that there are a number of organizations that have developed guidelines, including the International Union of Phlebology, the American guidelines from the American Venous Forum, the American Venous and Lymphatic Society, and particularly the European guidelines. So those are all three that are important in the world and that we tend to follow.
Okay. Thank you, Dr. Morrison, for enlightening us about that. So would you like to add to our community's knowledge from the studies conducted by you?
So we've done a number of studies. One of the non-thermal, non-tumescent techniques is the injection of foam to close a vein. We've done quite a lot of work over the last 15 to 20 years on that particular technique. And it's a very valuable technique because it's effective and it's inexpensive to deliver. That's one nice thing. The other non-thermal, non-tumescents are not inexpensive to deliver. So we have to be aware of that.
Okay. So Dr. Morrison, can you please explain about superficial thrombophlebitis treatment and management?
Sure. So superficial thrombohlebitis is an inflammation of the vein, sometimes associated with a clot. It's in the superficial system. We used to think that was not a particularly dangerous or problematic condition, but that's changed. The thinking has changed because now we realize that some people have, quite a number of the people who have superficial thrombophlebitis also have a deep vein component. That's a problem.
True.
That's much more dangerous. Watch carefully those patients. So it's shifted now so that we are treating more aggressively superficial thrombophlebitis than we used to.
Okay. So what particular management should one follow for such?
It depends on where the superficial thrombophlebitis is. If it involves one of the truncal veins, the small saphenous vein, the great saphenous vein, and it's close to the deep junctions, we are much more aggressive about using anticoagulation for a period of 3 to 6 months in those patients.
Okay.
If, on the other hand, it occurs in a small tributary, we can use anti-inflammatory agents, and we don't have to step up to the anticoagulation. But anticoagulation is much more commonly used now for that disease process than in the past.
Okay, Dr. Morrison. So lastly, any key message that you would like to share with the Docplexus community?
I think just as we study venous disease, we realize what we don't know. And there's a tremendous amount that we don't know, which makes the field a great deal of fun for investigators like us, because we get to study things that haven't been particularly well studied. So continue the study, pay attention to the new developments that are going on, and advance your practice as you go along.
And what are your views about YCon 2020? How are you finding it?
Oh, first of all, I like India a lot, and secondly, the VICON continues to grow in terms of its scientific content. Every year, it's better and better.
Thank you, Dr. Morrison. Thank you so much for such an insightful discussion. Thank you for your time.
You're welcome.
Thank you.